Except I can't see myself anymore.
Children who fall behind in the first months and years of life end up with significant health problems, higher levels of chronic disease, learning deficits in school, and even higher rates of incarceration. This presentation will discuss how these trajectories can be changed when we address how they happen and how to keep them from being the epigenetic reality for too many children. Please welcome our next speaker, George Halvorson, Chair and Chief Executive Officer of the Institute for Intergroup Understanding.
Thank you for inviting me to discuss this extremely important topic at this conference. It's a great idea to have a conference on social determinants of health. And the knowledge in that space is growing rapidly in very, very good directions. But a major problem that we have is that many people don't realize that many of the social determinants of health are actually triggered by what happens in the very first months and very first years of birth for every person in the country. The first, very, very first period of our life is a time of extreme developmental connectivity in our brains. In that period of time, neurons connect. And when the neurons connect, if they connect in large quantities, they're there for life, and they provide strength and emotional stability to each person. And if the neurons are not connected in that time frame, then we find ourselves with some really significant deficiencies and challenges relative to the lives that we lead. Major issues. And when we're looking at the social determinants of health, then we have many pathways and trajectories that are set up in people's lives in those early months and years that are stay with us for life. They literally permanently change our lives. Now, we are so much more sophisticated today in our understanding of epigenetics. We've been learning more about genetics. We have a growing body of science about DNA that is helping us in many ways. We also have a growing body of science about RNA and about epigenetic development. And we now know that what happens at the very beginning of life changes the way our DNA unfolds in our body. We literally have different pathways, different approaches, different health status that results from the pathway that happens in that very first time period. The people at some great researchers at Columbia have identified that they can look at a 100-day-old baby and predict with about 80% accuracy which of the 100-day-old babies are going to be in trouble in some major areas at age 3 and age 5. So this is really important information. When you look at our country, we put more people in prison than any country on the planet. We literally imprison multiple times people than any other country on the planet. We put 7 times more people in prison per capita than Canada. And when you look at who we put in prison, we overwhelmingly imprison our minority population. So we disproportionate number of African American and Hispanic American prisoners, but we also disproportionately imprison people who have dropped out of high school. When you look at who's in our prison, if you are an African American male in your 30s and you dropped out of high school, 60% are in jail today and 80% will be in jail in their lifetime. That's literally 60% in jail today. When you look at African American males in their 30s who graduated from high school, 10% are in jail. So 10% of the graduates are in jail, and 60% of the dropouts are in jail, and 80% of the dropouts will be in jail. So those are hugely horrible numbers. The rest of the world imprisons far fewer people, but what we overwhelmingly imprison are people who are dropping out of high school. And the really important information that everyone who is at this meeting needs to know is that we know by age 3 which path people are on. We know by age 3 because the brain development that happens in each person involves neurons that connect in the brain in the first months and years of life. And when you are interacting with a child in that time period, the neurons connect by the billions and even the trillions and give you a robust brain. But if you don't make that connection in that time period, not only can you not do it later, but the brain of every single child actually changes at age 4. And at 4, the brain purges itself of unused neurons, and the opportunity to connect them goes away. So what happens at age 4 is that if you haven't helped the child make those connections, and the children love those connections, they absolutely love the connections. Children get great joy and pleasure out of having the neuron connection process happens. But if you miss that opportunity and you get to 4 and you haven't done it, then you end up in a situation where you can't catch up later, which is why all of those wonderful programs all over the country that have worked on pre-kindergarten as a way of closing the learning gaps in our schools have failed. And the reason they failed is because the pre-kindergarten programs happen at age 4. And 4 is too late. You cannot catch up at 4. You should do wonderful, caring, loving, supportive things for the 4-year-olds and the 5-year-olds who are behind. But you can't help them catch up, close the learning gaps. And what we have right now in our schools is massive learning gaps. 60% of the Hispanic and African American children in most of our school systems read poorly or can't read at all. So it's literally 60% read poorly or can't read at all, and a number drop out. And as I said, the dropouts overwhelmingly end up in prison, but the ones who can't read at all are in major learning difficulty for their lives. And schools have been failing now for a couple of decades. We blame the schools, we blame the teachers, we blame the environmental issues, we blame various kinds of social determinants for the failure of the schools. And what's absolutely, totally true is that you cannot change the trajectory at 15 years for those children. You have to do it at 15 months. Because the brain is no longer making those connections at 15 years. So you can do loving, wonderful, caring, supportive things for the children at 15 years, and you should, because we need to help every kid and give every kid the best possible environment. But There haven't been any programs in any setting anywhere that has significantly closed learning gaps for children at 15 years, because the brain development necessary to do that happens in the first months of life. So the implications and the impact and the consequence of that is huge. It's horrible. It is, when you go to Chicago right now, there's a lot of murders in Chicago right now. A lot of people are being killed. When you look at the murders in Chicago, 90% of those murders are done by gang members. 90% of the gang members are high school dropouts. We know with 90% accuracy by age 3 whether or not those kids in Chicago are going to drop out of school. So if you want to change the murder rate in Chicago, and there's all kinds of really good, again, well-intentioned, heartfelt programs happening to do that, if you're going to do that and you change the trajectory to not have those kids in the gangs killing other people, you've got to go upstream and make a difference in Chicago in the first 15 months of children's lives. So that's very powerful information. And people hate that. People really, really hate hearing that information. I cannot tell you how many times people have said, that can't be true. I can't believe that's true. I won't accept that as true. And I wish it wasn't true. And we do need to help every child, but we need to help every child knowing that the ones who fall behind, we need to have a different trajectory for. We've got to find a different career for. We have to find a different approach. When you add to that information the extremely strong body of work that's now being done about ACEs, adverse childhood events, we can combine those two to really talk about the fact that if we're going to change basically the health status of our population, we do need to have an impact as early as possible for as many people as possible. The research done on ACEs, the adverse childhood experience research, was actually done initially at the Kaiser Permanente with a large database. And what they discovered was if you look at 10 possible adverse events that can happen to children in the first years of life, and then do a survey to identify who has how many of the events, a significant percentage have multiple events. And the more events you have, the worse the situation is. And what we know is that the children with 4 or more ACEs, 4 or more ACEs from that list of events, are literally twice as likely to get cancer in their adult years. Same population, twice as likely to get cancer, 3 times more likely to have a stroke, 4 times more likely to have a heart event, almost 5 times more likely to have lung problems. And in terms of drug use, 10 times more likely to be using dangerous drugs. And the children with 4 or more ACEs are 12 times more likely to attempt suicide. That's 12 times. Now, those are the same patients in the same population being treated by the same doctors. And the difference is literally 12 times more likely to attempt suicide if you've had 4 or more ACEs. So that's very powerful information. The state of California, our Surgeon General, brilliant Surgeon General, is working on ACEs for the state, and she's working upstream on ACE prevention techniques, and both working on preventing ACEs and early identification of ACEs, and then teaching the caregivers how to do interventions with the high risk patients who have multiple ACEs. So, California, we're doing some really good work in that space. But the really, really important thing to understand is that, again, we should go upstream into people's lives and try to create as few ACEs as possible. And we should intervene as quickly as we can anytime ACEs exist, and guide the patients and help them expect the fact that there's going to be much, much, much more challenging um, health conditions for them in their life. So we need to understand that data, and we need to use that data, and then we need to understand that this is epigenetic. This is literally the programming that we have built into our system by our genes, and that epigenetic programming is set up to respond to whatever environment we're in. So if we discover early that we are in a high stress environment, what that does is it causes our programming to work in different directions. And what we end up with on young boys who end up with a high level of stress in that early time and a high level of isolation, uh, tendencies toward presumptive negativity, where they basically assume that the world is against them and are much more aggressive relative to other people. There's just an assumption that um, the world is against them, and so they react with some hostility. And we actually suspended more kids from kindergarten this year in this country than we suspended from high school for behavioral issues. Much of that is presumptive negativity, and it's not the children's fault. And it's also not the teacher's fault. But we need to coach all the teachers. We need to have all the teachers understand that presumptive negativity exists. And when that child reacts to them with great hostility, they can't take it personally. They can't assume that this child is acting with that hostility because of something I did or because of me. It's basically that's the way the world feels to that child. And on the uh, girl side of the equation, we see much, much higher level with the same programming. We see a much higher level of depression in high school, and a level of passivity relative to some kinds of decisions. So we seem to be wired to go down two paths for early stress, and both of them we need to respond to in the most understanding way. And then we also need to do everything we can to keep that from happening. And what we know is that there is a major, significant impact on our health. So one of the studies we did at Kaiser was in the city of San Francisco, and it looked at high school graduates versus high school dropouts on health status. And one of the findings was that African American women who had dropped out of high school were twice as likely to be diabetic as the graduates. Again, same care system, same setting, same city, basically same economic status, but dropping out of high school doubled the rate of people becoming diabetic. So when you look upstream and you look at the chronic conditions and you look at the ACEs and you look at the other issues, we know that that has a massive, massive impact on our health that we haven't been thinking about. COVID is a really, really good test case for both social determinants of health and the epigenetic impact of those kinds of stresses. Because when you look all over the country, what we see is the African American and Hispanic death rate from COVID tends to be double, and in some settings, even triple the death rate of other patients. people suspected that that was genetic. It's not genetic. When Ochsner clinics did a magnificent study, and they looked at every possible factor. They looked at uh, diabetes, they looked at hypertension, they looked at other chronic comorbidities, and they put that entire package together. And what they discovered was that when you looked at the higher death rate, and their African American uh, patient death rate was triple for the African American, so much higher death rate. But it was entirely due to comorbidities. When they pulled out all the factors, when they made it exactly equal on all factors, and the only difference was race, it had zero impact. The one impact that had zero impact on the death rate was the race of the population. However, the patients who were African American in their setting were much, much more likely to have some of the comorbidities. So basically, that tells us that we need to, um, again, understand the higher risk, address the higher risk, and intervene based on the higher risk. So how do we make a difference? So when you look at what's happening in the lives of the children, this is something where we can make a difference. We can make a huge difference by going upstream and talking to the kids, reading to the kids, and most importantly, persuading the parents and teaching the parents about the opportunities for brain development and emotional security that happens in those first months and first years of life. We did a study in California. We looked at Medicaid mothers, and we identified that 90% of the Medicaid mothers did not believe they could have a positive impact on their child's intelligence by doing any particular thing for the children. There was a belief that whatever cards you were dealt were the cards you had to play for life in that area, that your intelligence was fixed for life. And that's not true, but it was believed by 90% of the people. So we set a goal at the First Five Commission of teaching mothers about that issue. And we ran ads, and we got the doctors to do some coaching, and we did some contact from multiple sources. And we ended up in a couple of years getting it up to 50% of the mothers believing that they could change their child's intelligence trajectory. In the most recent number we did, 85% of the California Medicaid mothers believed they could make a difference. So we spent some time doing really direct coaching and counseling and running ads to make that happen. And so that trajectory is different. And now those mothers in California know that they can make a difference in the lives of their children, and all mothers love their children. And all of the interactions are extremely rewarding. They feel wonderful. They feel so good when you are interacting with the child and the child is interacting with you, and it's a loving, positive interaction. That feels wonderful. So this is really easy lifting from that perspective, because it feels so right. It just feels good to both the parent and the child. So we need to go down the path. But, and here's the disparity and here's the inequity, what we know is that over half of the Medicaid families don't have a single book. So the average non-Medicaid family, and when you break it by race, the average white family has 12 to 20 books per child. The average Medicaid family didn't have a single book. Most of the Medicaid homes did not have one single book. And the reality is that when you have books in the home and you read to the child, you talk to the child. There's an interaction that goes on that involves many, many words being exchanged by the parent and the child. And what we now know epigenetically, it's important to hear those words. This is an epigenetic issue. We need those kids to hear those words. And what we know is that the families with no books hear on average 5,000 words or less by age 5. And the families who have even some books and who read daily hear 300,000 words by age 5. That's a huge difference. That's a huge difference. The families with dozens of books hear almost 1,000,000 words, but that's not the most relevant. What's relevant is that the daily readers end up with 300,000 heard spoken words, and the families with no books under 5,000 spoken words. And we need to get books to all of those kids. The kids love to have books. They really, really want books. The families feel good with books. When I've seen kids cry, when the 3-year-old kid cry with joy at getting a first book, because it is such a good thing to have. And we do a lousy, lousy job as a country, both teaching the parents that reading is a good thing, and then making the books available to the kids. And when you make the books available, you get a huge response. That one of the studies that was done, Berkeley did a great study of Hispanic mothers, and they identified the fact that only 40% of the kids were learning ready when they got to kindergarten, but 40% of the homes had books. Same family, same community, same education level, same income level. But 40% of the family had books. And in those homes, over 60% of the kids were learning ready when they got to kindergarten. So the Hispanic families in California that had books were 60% learning ready. And the families that didn't were under 40% learning ready. And we've seen that over and over again in the research. We did some work in Los Angeles County with the WIC program. We worked with basically the Medicaid-linked nutrition program that coaches every Medicaid mother on nutrition issues. And we worked with that program to get books into the home. So they coached about rutabagas, and they coached about vitamins and all of the green vegetables. And they also had books that they passed out to kids in Los Angeles County in about half of the school districts. And what happened in those settings was the kids loved the books, really loved the books. That made the kids very happy, because it turns out that they're not necessarily enthusiastic about lettuce and rutabagas, but they are invariably very happy to get the books. And when we tested the learning readiness, we saw that in the school districts where the WIC program passed out books to the earliest children, 0 to 3 children, they were up to 70% learning ready. And the rest of the county was only 30% learning ready. So WIC exists in every county in America. We could do this everywhere. We could do exactly what we did in Los Angeles County, every place in America. And if you're thinking about social determinants of health and a way of changing those trajectories to get people to the right place with their lives, then we need to make teaching all the parents about the brain development a major Medicaid agenda item. And we need to make it a gift and an obligation and a practice of getting that information to all of the children. So we need to get books to everyone. We need to coach everyone. Over half of the births in America this year are Medicaid births. Over half. That's a huge, huge opportunity. So we need to get to all of the Medicaid doctors and nurses in the country and teach them this. We need to get all the mothers to understand this. And then we need to get books to all of those kids in all of those homes. And I can tell you for an absolute fact, I have seen the kids and the mothers cry when they get those books, because when you're broke, you're having a hard time buying enough, paying for your food. I mean, the rent is hard, difficult. There are many, many challenges that exist for low-income children, and many pressures on the financial situation of those parents. We should not make books a financial burden. We should make books a functional blessing, and we could do that. So you're about to have a good conference. I really, really hope that this goes well for everyone. Learn a lot. In one final thought, we have massive economic gaps in America. We have a situation where the average Hispanic and African American family has a net worth of about $20,000. The average white family has a net worth of about $200,000. So it's $20,000 versus $200,000. That's a massive inequity. We need to fix that. But what we also need to realize is we're not going to change the earning gaps or the wealth gaps if the majority of the children being born into each of those groups can't read. We're not going to change that gap. We can do wishful thinking, magical thinking, politically correct thinking. We can do all kinds of positive thinking, but we're not going to change the earning gaps and the wealth gaps if a majority of the kids can't read. So let's make that a priority. We can make that a priority. Everyone who's at this meeting is really smart, well-intentioned, well-informed, and well-connected. Please use your connection to get books to all of our children. Thank you.